Hello students, today we are going to discuss about the shock. Okay, see, this shock is the failure of the normal regulatory mechanisms in the body is known as shock. Okay, what is the shock? Which is a failure of normal regulatory mechanism okay in the body is known as shock. Okay, what is the shock? Which is failure of normal regulatory mechanism in the body is known as shock. Okay, generally if you see this shock, which is characterized by suppose if there is any inadequate circulatory provision of oxygen, okay, so that which causes the vital organs or the tissues to shut down, right? See, suppose if these mechanisms are uncompensated, so definitely which may leads to impaired cellular metabolism as well as the death, right? See, simply this shock is how you can define as it's a failure of the normal regulatory mechanisms in the body is known as shock. Okay, see, generally what I'm saying, it's characterized by an inadequate circulatory provision of oxygen, okay, which causes the vital organs or the tissues to shut down, right? See, because of this inadequate circulatory oxygen, see, definitely the vital organs or the tissues are going to shut down, right? See, suppose if the mechanisms are compensated, so there is no problem. So sometimes what happens if it is uncompensated, so which may leads to impaired cellular metabolism as well as the death, right? Next we'll see the different types of shock. Okay, we'll see one by one what are the different types of shock. First one, you will call it as hypovolemic shock. Okay, second one is cardiogenic shock. Third one is distributive shock. See, this distributive shock, again, it's divided into septic shock. Next one is anaphylactic shock. Next, we are also having the other types of shock like traumatic shock. Next one is neurogenic shock. And the last one is hypoadrenal shock. Okay, see, these are all the different types of shock. Okay, we are going to learn today about all these different types of shock, right? See, first one is hypovolemic shock. Okay, next one is cardiogenic shock. Next, the distributive shock, if you see, it's again of two types, that is septic shock and anaphylactic shock. And we are also having the other types of shock like traumatic shock, neurogenic shock, and the hypoadrenal shock. Clear? See, first we'll see about what is meant by this hypovolemic shock. Okay, if you see this hypovolemic shock, which indicates if there is any inadequate circulatory blood volume, okay, see, which may leads to this kind of hypovolemic shock. See, inside our body, suppose the circulatory blood volume is very less. Clear? See, in that case, which may leads to this kind of shock is known as hypovolemic shock, right? We are having different causes for this hypovolemic shock. See, like hemorrhage. Suppose if there is any hemorrhages inside our body, see, definitely which may leads to decreased blood volume, right? See, which obviously leads to this hypovolemic shock. And next one is dehydration. See, those are some conditions which may leads to the dehydration, like vomitings, clear, or because of diarrhea. See, these two conditions which may leads to this condition of dehydration. See, because of this dehydration also leads to this kind of hypovolemic shock. And the third one is burns. And fourth one is excessive use of diuretics. Clear? See, when we are using the diuretic, suppose if there is more amount of water inside our body, okay, to remove that excess amount of water, we are using this kind of diuretics. Clear? If anybody is using the excess amount of this diuretics, so that there will be loss of more amount of water from the body, right? See, these are all the different causes which may leads to this condition of hypovolemic shock, right? See, next we'll see about the pathogenesis of this hypovolemic shock. See here regarding the pathogenesis, if you see mainly because of the different causes. Okay, until now we had seen all these causes which may leads to this kind of hypovolemic shock. See, but most oftenly, if there is any loss of the red cell mass, clear, suppose if there is more amount of loss of these red blood cells because of hemorrhage. Clear? See, first thing I told you, that is hemorrhage, which may causes this hypovolemic shock. Clear? No doubt all these conditions which may leads to the hypovolemic shock, but most commonly if there is a loss of this red cell mass, clear, see, because of the hemorrhages, so which may leads to this kind of hypovolemic shock. So this is also known as hemorrhagic shock. Clear? See, this kind of hypovolemic shock is also known as hemorrhagic shock. See, why you will call it as hemorrhagic shock here? See, that's because of loss of red blood cell mass because of hemorrhage. Clear? See, which may leads to this kind of hypovolemic shock. So this also known as hemorrhagic shock. Clear? See, and next one is, if you see regarding the severity of this hypovolemic shock, see, that's mainly depends on the degree of the blood volume that is going to be lost. Clear? See, that means how much amount of blood volume that has been lost from our body. See, based on that, the severity of this shock is going to depends. Clear? Suppose if you see from our body, if less than 1000 ml of the blood volume has been lost, if it is less than 1000 ml of blood volume has been lost, so this condition definitely it will be compensated inside our body, right? See, suppose if the loss is around 1000 to 1500 ml, this is, you will call it as a mild hypovolemic shock. If there is a loss of 1500 to 2000 ml, it's a moderate hypovolemic shock. And if there is a loss of more than 2000 ml of the blood volume, then it is known as a very severe hypovolemic shock. Clear? See, that's what I'm saying here. It's the severity of this hypovolemic shock mainly depends on the degree of the blood volume that has been lost from our body, right? So if it is less than 1000 ml has been lost, definitely it will be compensated. And suppose if the loss is around 1000 to 1500, you will call it as a mild hypovolemic shock. And if the loss is 1500 to 2000 ml, it's a moderate. And if the loss is more than 2000 ml, definitely it will be a severe hypovolemic shock. And next we'll see some clinical features. What are the clinical features you are going to be find out during this hypovolemic shock? First one is there will be an increased heart rate. See, definitely those who are suffering with this kind of hypovolemic shock, in that case, there will be an increased heart rate. Next one is there will be a decreased blood pressure. So obviously because of loss of fluids, they may experience this decreased blood pressure. And next one is low urinary output. It's very obvious, right? See, there is a lack of fluid inside our body. So definitely the urinary output will also be very less, right? And finally, you may observe some alterations in the mental state also, right? See, these are some clinical features you are going to be observed in case of this hypovolemic shock. See, not only this hypovolemic shock, whatever the different types of shocks, okay, that are present, in all these cases, these are the common clinical features you may observe, right? So this is all about the first one, you will call it as, that is hypovolemic shock, right? See, next we'll discuss about the cardiogenic shock. Okay, second one is cardiogenic shock. See here, this because of acute circulatory failure, there because of acute circulatory failure with sudden fall in cardiac output. Suppose if there is any sudden fall in cardiac output, clear, see, which may leads to this kind of cardiogenic shock. Clear, see, what is this cardiogenic shock? Here it's because of acute circulatory failure with sudden fall in the cardiac output. Clear? So because of this sudden fall in the cardiac output, okay, see, which may leads to this kind of shock is known as cardiogenic shock. Okay, see, we'll see what are the different causes for this cardiogenic shock. The first one is myocardial infarctions. See, it's a disease of cardiovascular system, that is myocardial infarction. And if there is any care of the heart, okay, or if there is any or some because of rupture in case of capillary muscle. Because of different causes for this cardiogenic shock. The first one is the myocardial infarction, the next one is the rupture of the heart, ventricles, or the papillary muscles. The next one is the cardiac arrhythmias and embolism or the thrombus. So these are all some causes which may lead to this kind of cardiogenic shock. Next, we'll see about action. If you see, Here exactly the heart muscles unable to receive that is sufficient amount of oxygen, so which may leads to the death of the muscles in the heart, which leads to the condition of myocardial infarction. Okay, exactly. If you see this myocardial infarction, okay, because of this myocardial infarction, which may leads to left ventricular dysfunction. Clearly, definitely you may observe this kind of left ventricular dysfunction, which causes the decreased cardiac output, which leads to decreased tissue perfusion. Clearly, because of this decreased perfusion, which leads to movement of fluid from the vascular bed blood capillaries, the fluid is going to be moving on to the pulmonary interstitial fluid. Here leads to the condition we will call it as a interstitial pulmonary edema. Clear? See, later on, what happens? The fluid, okay, that is the vascular bed, which is moving into alveolar spaces. See, this may leads to alveolar pulmonary edema. This may lead to alveolar pulmonary edema. Okay, so this is how your cardiogenic one foremost cause we are seeing here is the myocardial infarction. So because of this myocardial infarction, there may be a left ventricular dysfunction you are going to observe. So because of that, there will be decreased cardiac output. Finally, there will be a decreased tissue perfusion. See, because of this decreased tissue perfusions, there will be movement of fluid from the vascular bed into the pulmonary interstitial, that is spaces. Clear? See, this condition which may leads to that is interstitial pulmonary edemas. Here later on, what happens? Whatever the fluid that are present in the vascular bed, that is going to be moving into the alveolar spaces. This you will call it as alveolar pulmonary edema, right? So this is about the cardiogenic shock, and next we'll see about the distributive shock. Distributive shock. Distributive shock is the blood vessels expand too much and not able to keep the blood circulating to the organs. Clear? See here, what is meant by a distributive shock here? So that is the blood vessels are going to expand too much. Clear? See, because of expanding too much the blood vessels, okay, see, which not able to keep the blood circulating to the organs. Clear? See, that type of shock you will call it as a distributive shock. See, it's of two types. I told you the first one is the septic shock and next one is the anaphylactic shock, right? See, first we'll see about septic shock. Clear. See, septic shock is the because of severe bacterial infections. Clear. See, suppose inside our body if there is any severe bacterial infections. Clear. Suppose if there is a severe bacterial infections inside our body, so in that case, which may leads to this kind of shock is known as septic shock. And if you see the causes for this septic shock, mainly two things. Okay, that is two kind of bacteria. First one is the gram negative bacteria, okay, which may leads to endotoxic shock. And if you see regarding the gram positive bacteria, which causes exotoxic shock. Clear. See, among these two, because of this gram negative bacteria, whatever the endotoxic shock you are going to be observed, it's more common, right? When compared to the gram positive bacteria, which is causing this kind of exotoxic shock. See, what's the difference between these kind of endotoxic shock as well as the exotoxic shock, right? See, if you see here, this endotoxic, okay, the name itself indicates. See, that means whenever inside our body, if there is any gram negative bacteria, clear. See, after the lysis of the bacteria inside our body, see whatever the contents, okay, that are present in the cell wall of the bacteria, clear. So that is going to be released inside our body, and which is causing the destruction to the cells inside our body, right? See, because of that, which may leads to the condition of septic shock, okay, that we will call it as endotoxic shock. And the next one is coming to the exotoxic shock here. See, that's not because of the products of the bacteria, but the bacteria is going to be releasing some secretions. Clear. So because of that secretions inside our body, our inflammatory mechanisms got activated. Clear. See, because of activation of that inflammatory mechanisms, which may lead to the exotoxic shock. Here, see this small difference between an endotoxic shock and an exotoxic shock. You remember, endotoxic means that's because of the products of the cell wall of the bacteria, which is causing destruction to the cells. Okay, next, exotoxic means secretions that are going to be secreted by the bacteria, which is in turn activating the inflammatory mechanism and which is causing destruction to the cells, right? So there's a small difference between endotoxic shock and the exotoxic shock. Next we'll say about the pathogenesis. Okay, first one is activation of macrophage monocytes. Okay, first one is activation of macrophage monocytes. Okay, we'll see how these macrophage monocytes got activated. Okay, which may leads to this kind of septic shock. Clear? See, suppose if there is any lysis of gram negative bacteria, so which is going to be releasing the endotoxins, like previously I told you, it's a product of the cell wall of bacteria, right? See, that is lipopolysaccharides, LPS. Okay, you will call it as lipopolysaccharides that are going to be released into the circulation. It is going to be released into the circulation. Whenever, see, if there is any lysis of this gram, it is going to be releasing immediately the endotoxins, we will call it as lipopolysaccharides, into the circulation. Clear? See, this lipopolysaccharides binds with lipopolysaccharide binding proteins, and it is forming a complex. Clear? See, this complex is going to bind with CD4 of macrophage. Clear? See, whenever this complex binds with this CD4 of the macrophage, immediately it is going to be releases the different types of cytokines. These cytokines having the different roles inside our body. Okay, we'll see what these cytokines will do inside our body. Clear? See this first one, that is the activation of macrophage monocyte. Okay, whenever the lysis gram negative bacteria, so which is going to be releases this kind of endotoxin is known as lipopolysaccharides into the circulation, right? So this lipopolysaccharides binds to this lipopolysaccharide binding proteins and is forming one complex, right? Since this complex binds with this CD4 of the macrophage, immediately it is going to be releases the cytokines, right? See what happens. Okay, what is the main functions of the cytokines? We'll see. Clear? See, once the cytokines are released, okay, what these cytokines are going to do inside our body? Clear? See, these cytokines, first thing is, it is going alters the endothelial adhesion molecules. Okay, it is going to be alters the endothelial cell adhesiveness. Okay, so because of that, which is going to be recruits all the neutrophils. Clear? See, because of this, which can liberate the free radicals. Clear? See, once if the free radicals are going to be released, which may lead to vascular injury. Okay, see, this is the first thing it is going to be doing, the cytokines. The second one is the cytokines, which also synthesizes the nitric oxide. Because of that, which leads to vasodilation, and next is the hypotension, right? So hypotension. And here case of distributive so much, right? How cells are going too much? So that's because cytokines. Okay, these cytokines are going to be synthesizing these kind of molecules known as nitric oxide. So this nitric oxide which is causing the vasodilation and the hypotension, right? So this is about the first thing, that is activation of macrophage monocytes. Okay, next pathogenesis, if you see, that is activation of inflammatory response. Okay, we are discussing about the pathogenesis of this septic shock. Okay, in that the second one is activation of inflammatory response. Yes, so because of this activation of inflammatory response also leads to this kind of septic shock. Clear? See, that means whatever the microbial infections, okay, that are present inside our body, which can activates the other inflammatory cascade reactions inside our body, which may leads to the shock. Okay, see, that means what are the things that is going to be activating these bacterial infections? The first one is, which is activating the complement pathway. First one is, it is going to be activate the complement pathway. So because of activating this complement pathway, which may leads to endothelial damage. Clear? And next one is, which can activate the mast cells. Clear? See, whenever the mast cells got activated, immediately the histamine inflammatory mediators are going to be released from the mast cells, right? See, because of this histamine, okay, whenever the histamine is going to be released, which is going to be increases the capillary permeability. Okay, and next one is activation of coagulation system. Okay, this coagulation system also got activated. So because of this, which is going to be increases the thrombi development. Okay, and finally, if you see, there will be an activation of signing system. So because of this activation of this kinin system, which is going to be releases the molecules like bradykinins. So because of that, which may lead to vasodilation. See the final effect if you see the vasodilation, right? See, and which can also increases the capillary permeability, right? So this is about the septic shock, and next we'll see about the anaphylactic shock. Okay, as I said, the clinical features will be similar to all the types of shock. Okay, as we are discussing about the distributive shock, okay, the second one is anaphylactic shock. Okay, see, this anaphylactic shock is nothing but it's a severe allergic reactions to an antigen. Clear? See, whenever if any antigen that are present inside our body, in response to that antigen, if there is any severe allergic reactions inside our body, right? See, which may leads to this kind of anaphylactic shock. And if you see the causes like penicillin, here that means this penicillins, okay, will not respond. Okay, it's not being responded by all the individuals in the same manner. So some individuals are more allergic to the penicillins. Clear? See, that means because of this penicillins, okay, which may also leads to this kind of anaphylactic shock. And next one is sometimes insect stings. Clear? So that means because of insect bites, okay, which may lead to some allergy in the body, right? Which may also lead to this kind of anaphylactic shock. And some people are allergic to milk, and some are allergic to the eggs, right? So these are all some causes which may lead to this kind of anaphylactic shock. And next we'll see the pathogenesis. Okay, here, see, I told you whenever any antigen that are present inside our body, that is, if there is any antigen, which may leads to immediately the activation of antibodies. Clear? So whenever antigens are present, obviously there will be activation of antibodies. So because of that, which may leads to antigen antibody reactions, right? See, because of that, which is going to be causes the release of some vasoactive mediators. Clear? See, whenever these vasoactive mediators are released, immediately causes vasodilation. Clear? So this is the final motto of this distributive shock, that is the vasodilation, right? So this what is going to happen in case of anaphylactic shock, right? See, whenever if the antigen, any antigen present inside our body, immediately there will be an activation of antibodies. So because of that, okay, which causes antigen antibody reaction, so which is releasing some vasoactive mediators, right? So because of that, which may leads to the vasodilation, right? So this is all about the third type of shock, that is about the distributive shock. And next we'll see about the other types of shock. See, in that the first one is the traumatic shock. See, I hope you all know what is meant by this traumatic shock. That means because of any injuries inside our body, some people may okay, go to this kind of shock, that is traumatic shock. Clear? So because of injuries, which may also leads to sometimes, okay, even though it's very rare, definitely there is a chances of getting this kind of shock, that is traumatic shock. Clear? See, suppose if you see, okay, cause means it's only because of injury. The next, if you see regarding the pathogenesis here, suppose if there is any tissue injury, Clear. Suppose if there is any tissue injury because of some major accidents, SIRS. Okay, this SIRS is going to be increased. Please see what is meant by this SIRS. Okay, see that is like temperature, heart rate, okay, WBC count. Okay, all these things are going to be increases. Okay, this you will call it as SIRS. Okay, this is going to be increased. So because of increased these conditions, immediately the ATP is going to be released. Clear? See, whenever the ATP is going to be released, which causes systemic vasodilation, and next, which also causes that is whatever the oxygen, okay, that oxygen is going to be uses very abnormally. Not normally, but abnormally, the oxygen consumption is going to be very high. Clear? See, because of these two conditions, which may leads to hypoperfusion, which causes ischemia, finally leads to organ dysfunction. Okay, say this about the traumatic shock. Clear? See, here you can see here that is because of tissue injury. Here SIRS is going to be increased. It's like temperature, heart rate, and WBC is going to be increased. So because of that, immediately the ATP is going to be released, which is causing vasodilation, and the oxygen is going to be used very abnormally, right? See, which may leads to this hypoperfusion. Because of this leads to ischemia and finally leads to the organ dysfunction. Okay, see this about the traumatic shock, and next we'll see about neurogenic shock. Okay, see this neurogenic shock, it occurs as a result of disturbances in the sympathetic outflow. Okay, suppose if there is any disturbances in a sympathetic outflow, okay, which is finally causing there will be a loss of the vagal tone. Clear? So simply the neurogenic shock means it occurs as a result of disturbances in the sympathetic outflow causing the loss of the vagal tone. Clear? See, the main cause for this neurogenic shock is if there is any trauma to the spinal cord. Clear? See, suppose if there is any injury to the spinal cord, definitely which may leads to this kind of neurogenic shock. Clear? Next we'll see the pathogenesis. Clear? See, suppose if there is any disturbances in case of sympathetic outflow. Clear? See, which causes loss of sympathetic tone. Clear? Which causes vasodilation because decreases venous return, causes decreases stroke volume, decreases the cardiac output, finally leads to decreased oxygen supply to the cells, which may leads to impaired that is tissue perfusions, impaired cellular metabolism finally. Clear? See, this is about the neurogenic shock. Clear? See, suppose if there is any disruptions in the sympathetic nervous system. Okay, see, which may leads to the loss of sympathetic tone, causes vasodilation. So because of this vasodilation, it is going to be decreases the venous return and decreases the volume, cardiac output. Because of that, decreases oxygen supply to the tissues, which finally leads to impaired tissue perfusion and impaired cellular metabolism. Right? About about adrenal shock. See, adrenal shock. Okay, this is a shock that is ability of the adrenal gland. Okay, that means okay, may lead to this of hypoadrenal. Okay, main cause is here. May lead to this kind of hypoadrenal shock. And if you see regarding the pathogenesis here, suppose if the adrenal gland it fails to release the hormones, clear? So definitely the adrenal gland if it fails to release hormones, clear? Suppose if there is any problem with the adrenal gland fails to release the hormones, clear? Which may leads to adrenocortical insufficiency. So that means mainly the cortisol, okay? The cortisol hormone insufficiency mostly you are going to be observed, right? So why? Because this cortisol hormone which plays a very important role inside our body, so that unable to meet the physiological needs. Here, so this is about the hypoadrenal shock. Okay, the main cause is because hormones and which may leads to this adrenocortical insufficiency. Right? So that means the cortisol has to be decreased because of this adrenal gland, and because of that the decreased cortisol levels inside our body, so this is unable to meet the physiological needs inside our body, so which leads to this kind of shock is known as adrenal shock. Okay, see, that's all students about the different types of shock. Okay, in the next class we are going to discuss about the different stages of shock, and we'll see the different treatment or the management